only constant is change. So we're changing too, constantly learning and evolving to be more useful to you. So what if your medical plan could do more for you? What if it could encourage you to live healthy? Introducing A Plus Health, the medical plan that rewards you for living healthy. And the first of its kind to do so. With our Health Wallet feature, money will be credited into your Health Wallet when you don't make a claim for the year. And you can use it to support your health journey with benefits that are not typically covered by medical plans today, such as prevention, special care benefit, recovery and support benefit, Protect Boost. AIA Vitality members can also enjoy additional benefits, depending on your AIA Vitality status. Because if you're staying healthy, why shouldn't you be rewarded? That's what we believe. But we also believe in providing the best coverage when you need it. A Plus Health offers an annual limit of up to 2 million ringgit and no lifetime limit for inpatient and outpatient hospital expenses, such as outpatient kidney dialysis and cancer treatment. Apart from that, we now cover maternity complications, optical support, and more. For added value, you can choose the 300 ringgit deductible option to enjoy lower premiums. Because however much we change, we always want to give you the best. A Plus Health, the first medical plan that rewards you for living healthy. Brought to you by AIA, enabling healthier, longer, better lives.
Hi, good evening, everybody. Welcome to Kingdom Coffee Talk. My name is Jasper Wong. Today I will be hosting this session we call COVID-19 virus versus vaccine. Okay, so nowadays, every day we will receive the number about how many people have COVID, how many cases in this in our social media. That's why a lot of people they are very concerned about COVID, and at the same time, a lot of people are going to take vaccine or would like to know more about COVID vaccine. So today, this topic we very grateful that we have invite a doctor and some guests to share with us about COVID-19 and also about vaccine. So without further delay, I would like to introduce Dr. Mirasha to our show. Dr. Mirasha.
Hi, Jasper. It's
Hey, Dr.
very,
Mirasha.
yeah, hi,
So,
hello. It's
uh,
really good to join this show.
yes.
Yeah,
Actually, first
so
of all, I would like to say thank you for you because I know you are as a frontliner, your time is very much precious than us, because I understand you have different working shift all
yes,
this.
yes.
So it's very good that you're able to help us to be our guest to
It
join
was,
our.
I was fortunate enough because today was coincidentally I got an off day, but I need to be back to work this weekend.
Oh,
So that's why I could join this talk show today.
yeah, it's very good about that, actually. So, Dr.
Okay.
Mirasha,
Yes.
so you as a frontliner, right? So before COVID happened, right?
Okay.
After the COVID kick in,
Mm-hmm.
is it affect your workload from now?
Yeah, definitely. This COVID surge
Mhm.
have definitely affect our workload. I can say that it has increased tremendously. Okay,
Okay.
our workload, and not only in terms of the workload, but the whole SOP has changed, and
Oh,
it also add on to our stress, our work, our mindset
okay.
has been more stressful. because it's not only the workload, but
Mhm.
the how we handle the patients that are being infected with this COVID-19 or at
Oh.
risk of being infected with COVID-19 virus. So, the way we handle them is different. We have to gown up, wearing our whole PPE, and
Oh
that
yeah,
is,
the white shirt, right? Like a
yeah, the white
astronaut
shirt,
shirt.
the whole like that, like like going through the space kind of the
Yes,
space. We
yes,
call it as
yes,
the space baju.
yes,
So
yes.
it's very it's quite a number of them will keep on talking about the heat. It's very
Yes,
sweating, the heat of
yes.
wearing it. But for us, above than that, wearing that, we couldn't see anything
Oh,
because the face shield, everything will be full with our vapor, with
oh,
our breathing vapor, everything. So we could hardly see the patient. Even when we want to talk to
oh.
them, it's very difficult. And then for us to do procedures, when we meet the
Okay.
patient, definitely we want to take some blood tests and all. And
Mhm.
another thing, not only the blood test, even to take a swab, it's very difficult for us.
Oh,
So yeah, and as for me, I'm working in this pediatric department, involve kids.
okay.
So kids, they cannot obey your command. Okay, I'll be
Yes, yes.
getting kids 2 months old, 3 months old. So it's very hard for us. But
Oh,
yet, yeah, but yet we still have to do it for the safety of
yes.
everyone.
That's why we
Yeah.
really appreciate all the frontliner that working for us every day without taking any leave. Because as I know, doctor and nurse, I think not easy to get leave nowadays. Short of
Yes, true,
manpower.
true.
Yeah.
Actually, I will never say like doctors and nurse. I will say that whole medical fraternity, it's very difficult because when we say doctors and nurse, there are actually more than that are involved in this
Okay.
medical field. Let's say the lab assistant, you need them because they are the
Oh,
one going to run your swab test and everything.
yeah.
And then we also need our this runner to
Mhm.
send the
Document.
specimen from the ward to the
Oh,
lab. So there is not only limited to doctors and nurse, there are a
oh,
lot of them are involved. So
yeah.
like recently during this Raya break, actually a lot of our Muslim friends, Muslim colleagues were coming to work and they were working even on the Raya
Oh,
day.
oh,
And it's
during
not
Maya Day.
Yes, during because I
Oh,
was post call on the Raya day, and I can say everyone was there, and they
okay.
sharp 7. They are already in their duty. So that is
Oh,
something that is, yeah. So they willing to sacrifice their time with
yes,
families,
yes,
and especially during that celebration. So yeah,
yes.
that's what I say. It's not limited to just doctors and nurses. There are a lot
Mm,
of them that are
really.
involved.
Because running a hospital need a lot of others workers also.
Yes,
Yes.
yes. Most of the time, the only person that we can think about is the doctors and the nurse, but
Yes.
there are actually more than that. And
Oh,
not
yeah. Don't
forgetting
think
all
about that.
those these cleaners, because you
Mm-hmm.
need them because there is a special
Oh,
method of cleaning. The moment we receive a patient who are being suspected to have this
we-
COVID-19 infection, so the
yes.
way the cleaning and everything will be different. You have to use a different disinfectants. Everything is
Oh,
different, so you need them also.
then we
So
take
yeah,
more time to do that cleaning part.
yes,
Yes.
they also need to gown up. They also have to, and then the security
Oh,
guards,
they also
they
need to
also,
pick up the PPE.
yes. It's
Oh,
not only those that
okay.
handling the patient, but the pathway,
Oh,
because these patients might come up from the emergency up to the ward. So the whole pathway need to be cleaned. So it
oh,
will be done by our friends,
oh.
who are responsible for this
Different
cleaning and
outfit.
etc.
Oh, different kind of duty
Yeah.
lah. Oh,
Yes,
okay, okay,
yes.
okay. So, but is it this one is during your work time, ah?
Okay.
So after your work time, does it affect your daily life? Because
Yes.
I heard that some doctor they very worried about it, and even they don't want to go back home. They just maybe rent a room or stay at hospital, even sleep at hospital. The one I saw
Yeah,
in
yeah,
India,
that's
I
true.
don't know
That's
that's
true.
true or not.
especially when we have small kids at home and we
Yes.
have our elderly parents, we are very concerned of, because these are the two groups of people that can easily get infected
Oh,
because of
okay.
their low immunity. So definitely there is a fear. So most of
Yes.
us, what we used to do, that we used to clean ourselves before we go back,
Go back.
which means
Oh,
there will be facility for us, washroom and
oh,
everything, that we can take bath and all. Even we are being advised to do so, especially those
oh.
of us are working in this COVID team. So we are actually advised to do so before going back home.
What do you mean by COVID team? There are different rules of doctors, is it?
Yes. COVID team. What I meant by COVID team is that COVID team is like, let's say, for example, in my
Okay.
department. So if there is kids or anyone that is coming presenting with flu and cough, so even though they don't have a history
COVID.
of being infected with this COVID-19, but we will
Okay.
definitely isolate them. We will take
Even
a swab.
though even though it's just normal cough.
Yes. That
Wow,
was
very
during
good.
the first wave. But now, whatever symptoms you are presenting, even abdominal pain, diarrhea, also it's considered that you might get infected with this COVID. The symptoms are
Oh,
very weak. Yeah. So
oh.
what we do is we will isolate these patients. We will
Hmm.
take their swab, and let's say they are negative, then only we will mobilize them to the respective other wards.
Oh,
So the ward that we are isolating them and we are taking the swab. So this ward is called as the COVID team, the COVID ward.
oh. So it's actually this is a special setup, right? During COVID, there's special
Yes,
setup.
it's a special setup. Previously, it was just a normal ward, but as soon as this COVID surge, so we have to change that ward into, we will call it as a COVID ward.
Oh,
So the
understand.
moment the patient comes in there, so they are getting swab, isolate, negative, we will send them out to different ward. But if, let's say, they are positive, then we will send them to the respective hospital that is receiving the COVID positive patients.
Your
So
your
the doctors,
the
sorry,
hospital that you're working in, they don't
for
receive
now,
any COVID.
Selayang, we don't deal with COVID-19 patients. We send our
Oh,
patients to Sungai Buloh.
okay.
But with the increasing number of cases,
Yes.
Sungai Buloh is also having a tough time to deal with overload. There are overload. So
Yes.
most probably Selayang will be opening soon via
Oh, you,
COVID-19. Well, most
okay.
probably, because we need to help them. We need to help them
Yes.
because Sungai Buloh is, their workload
Over.
is, yeah, it's overwhelming. You can see, right, the cases are going up
Yes.
every day. Yeah.
Today is
But
7,000 plus.
for now, we are mobilizing all our positive cases to Sungai Buloh.
Mm.
So
Oh,
the doctors, nurses that works in this COVID ward, we call them as the COVID team.
oh, I see. So I believe
Mm,
in Sungai Buloh, their workload is much higher than current in normal hospital.
definitely,
Like.
definitely,
Oh,
definitely.
okay.
Mm.
So that any action that you're taking to prevent infection, except for the PPE, all this. Do you take any vitamin, all this?
Yes. In terms of vitamin, you mean supplements
Mhm.
and all? No, it's actually, it don't really help. It mostly, uh, apart from this PPE and all, the very important thing is the hand washing, which it seems to be very something that is very light, something that is not very important. People be
Okay.
thinking it's only hand washing. What is so great about hand washing? But actually, hand washing, hand sanitizing is very important, very important. So each and every
Oh,
time, whenever we deal with anything, let's say before we touch a patient, especially, or after we touch a patient, after we touch any of the equipments, everything, we have to uh, hand wash.
sanitize.
Yeah, and
Oh.
there is actually 7 steps in hand washing.
Huh?
It's not like the
Oh.
normal. Yes, it's not
Wow,
like
just
the,
just rub like this, then
yeah,
can get.
yeah. It's not that the normal
Oh.
rub. Actually, there are steps, about 7 steps in this hand washing. That's the proper
Wow,
hand washing.
wow, it's not easy. I can imagine
Yes.
if you work there, then wow, very tough, very tough. And every
Yeah.
day the patient coming in like non-stop one, is it?
Sorry.
the patient coming in like non-stop, I think. But
Yes, yes.
you are in
Pediatric.
pediatric department, right? I think
Yeah.
is it lesser compared before COVID because I think seldom people to go there or send their kid to for check out anything. Is it? Will it affect? I mean,
You mean
less.
the workload in pediatric department?
Yes, yes. Increase
It's,
also.
yeah, it's increased because you know why? Even now, our mothers who are delivering baby, so if the
Yes.
mothers now, quite a number of mothers are being tested positive.
Oh, okay.
So the baby that they are delivering, it's high likely to be infected also. So we have to
Oh,
deal with that babies. And
so the baby
besides
born
that,
with COVID.
there can be, we
Oh,
call it as a
oh,
vertical transmission, that means from mother to babies. So there can be.
oh,
And besides that, even babies when they brought them back home from ward or babies at home, they are
okay.
also very easily being infected with this cough because by people visiting home, you know, the neighbors they used to visit, and then
Yes.
whenever they have small gathering, so
Yes.
sometimes we can't blame them also with our situation now that we can't go out anywhere. You know, sometimes we feel
Yes.
so stressful. So we want to meet we want to meet just our neighborhood people and
Yes.
all. So when these people come and visit them and all those things, sometimes relatives come and visit them. So babies, they could easily get infected
Oh,
with cough, flu. So
that's
we
why
have these babies coming in.
my friend just deliver. I also not there
Uh-huh.
to visit. Yeah, just in case. Maybe after COVID, after better situation,
Yeah,
getting
yeah.
better.
My advice is like the numbers, let
Yeah.
the infection settle
Yes.
down. Let us
Yes.
get vaccinated, and then
Yes.
I think it. Then after that, we can start a normal life.
Yes.
Now,
Yes. Yes.
even though it's very difficult, definitely the life now is very, very difficult. Even I myself feels very stressful, not going out anywhere, you know, work home, not meeting anyone, not meeting our own family members. It's definitely not easy, but we have to sacrifice this.
Oh, yes. Yes. So,
Yeah.
and as I know, frontliner, you all will take a vaccine much earlier than
Early.
us, right?
Yes, yes. We took our
When?
vaccine much earlier. It was in March. My first dose was in March. My
Oh,
second dose was in April, early April.
oh, okay. Yeah, got
Mm.
some question coming in from Kevin. Is it safe for us to bring our kid to check out in hospital that have swab test service?
Yes, it is safe. Okay, why am I saying that? So, yeah, quite a number of them actually they are afraid to bring their kids to hospital
Yes.
because of they this is a very common concern that we got from the parents because they say the hospital is full with COVID. So
Not
they will
safe.
bring, yeah, they say they are not safe. And you know what happens? They bring when the child almost collapsed at home or
Oh,
collapsed, then only they will bring.
oh,
So when we
okay.
ask them, they will say we are having symptoms, the baby is having symptoms for 10 days, 1 month, but then they wait until until the baby collapse.
Oh,
So
you.
actually, when it comes to, let's say, when it comes to kids, when it comes to
Yeah.
pediatric, we are
Okay.
extra concerned. We don't allow kids to stay long in our emergency because every
Oh,
patient that visit to hospital, they have to go through the emergency department.
yes,
So
yes.
for kids, we don't allow them to be in emergency department a very long time. So the moment a baby arrived at emergency department,
Yeah.
we, the pediatric MO, will get a call and we will review the patient in the emergency department as soon as possible. And we will
Oh,
bring them up to the ward if they need to be admitted.
oh,
This is for kids more than 28 days, more than 1 month. For babies, we will
okay.
never allow them to be in emergency. We will as soon as possible we will see them and bring them. If they need admission, we will bring them up to NICU.
But just for normal checkup because newborn baby, they have checkup time.
Okay,
Every
for the normal checkup is in the clinic kesihatan.
yes.
It's not in the hospital. So in
Oh,
clinic kesihatan now they have slots. They don't receive everyone at one go.
oh,
So they give you appointment. So now
oh,
everything goes
oh,
by appointment. Like those days before the COVID time, they just give you come at 8 o'clock, Then you go at
Okay.
8 o'clock, then you can see quite a bunch of babies will be there. But now it's not that. Now it's they
Yeah.
arrange. In a day they only receive like 3-4 patients.
Oh.
Yeah,
Wow.
I have a baby, so I'm
Yeah.
also going through this routine now. Yeah, next week is my
Oh.
baby's due for vaccine. So whenever so every time the staff nurse, they will liaise with me, and they will say, okay, this is the time, so Friday 2 o'clock. So when I ask for other days, they say, oh, I'm sorry doctor, because other days we are packed, we only receive 4 babies in a day.
Oh. So I
So
mean, since you have a baby, so you will do the checkup and the vaccine like normal, right?
yes, normal.
Oh. Okay.
My
Okay. I hope.
advice is, because of this COVID, don't ever like miss the vaccine that baby's
Yes. Yes.
supposed to take,
Definitely.
or miss their checkup. No, never.
Oh.
Try to schedule. No, I mean, not to say try. It is the norm now that we are actually scheduling our patients. Even our patients in our clinic, we are
Okay.
scheduling them. We limit the babies in a day. We limit our patients. We are not taking a lot of them.
I hope your answer can answer for good enough for Kevin. If got
Yeah.
any question again, Kevin, please ask. Very fast, another
A
question, please.
pregnant mother still breastfeeding is safe to vaccine. Yes, I'm one of the example.
Oh,
So
so
I was
okay.
breastfeeding mother. So when I took my vaccine, I was breastfeeding my baby. So
Oh,
even after I took my vaccine, I breastfed my baby,
oh.
and there was no any effect.
So
My
today you take
baby,
the thing, you still can breastfeeding like normal, is it?
yes. This
Oh,
is a controversial topic that is going on, but when we look through the mechanism of the vaccine, how
yeah.
the action and all, it actually there is enough evidence that it doesn't give much effect to a breastfeeding mother. So
Oh,
I can say that because I'm a breastfeeding mother. I took my vaccine, and so far so good. And my
yes.
colleagues who are also breastfeeding, they have also took the vaccine, and I don't receive any comments from them. They are also good. So far, they are so good.
Good. Yeah, very good to hear
Which
that.
vaccine or any vaccine? um, I would
So
say
I
any
believe
vaccine.
any vaccine will be good
Any
enough.
vaccine. Okay, yeah.
Okay.
Because when it comes to vaccine, I knew that there are so many vaccines in the market now. But for a vaccine to be approved and to be used by the public, it has to go through several process. We can't just straight away, just by limited studies and all, approve a vaccine. So if you ask me, all vaccines, there is no such thing as a good vaccine and not good vaccine. The moment a vaccine is approved to be used, it is good for everyone.
You do share to me before that every vaccine they have go through 4 step, right? 4 stage, right?
Yeah, there is a
Oh,
process. Not for every.
so it's not easy lah to get
Yeah,
approved.
not easy, not
Oh,
easy. Not only vaccine, even anything new, let's say our normal medicine, antibiotics, everything, there is a process to go through. It's
okay.
not that you can't come up with a vaccine in just 1 month. That will never happen. So there's always trials going on. Just that what happens is, certain vaccine, they have this higher study result, which means that their
Oh,
group of participant is more, so they
more,
have a more concrete, a more better evidence by the
more
group
data,
of
more
study.
collected
The
data.
data and all, it's more.
Oh,
So
okay.
some, so others, maybe the data is less and all, but that doesn't mean their efficacy is
Oh,
different
yeah,
or it's
understand,
harmful.
understand.
Instead of efficacy, I won't say that, oh, because of the data and all, it's lower, so this is harmful. No, it's
Yeah,
definitely not harmful, because if it is really harmful, we will never release it to the use of public. Not only
yes,
to the public, we will never release it to the use of anyone if it is
yes,
really
yes,
harmful.
yes,
Yes,
yes.
yes,
Agree with that. Agree with that. So
yeah.
today is very happening. Another question from Jason Kong. If unable to get exact from government, can we get vaccine priority? I think we can, right?
We can. As long as you get vaccinated,
Yes.
it's okay. But I don't think so right now. They, even in our private sectors, the vaccines are available, because it's all being controlled by the government actually.
Yes.
Yeah. So, but
Yes.
if it is available in private, yes, go ahead. There is no harm.
Yes. So as I
Yeah.
know, because the COVID they have mutate, right? So
Yes.
actually, how does it mutate?
Okay, the mutation of a virus is always from the protein where we call as the mRNA.
Okay.
So to make it simple and easy, it's not only virus, any organism,
Yeah.
okay, let it be bacteria, let it be virus, any organism, it's very easy for them to mutate. Because
Oh,
we human being, we call it we as the higher level of organism, so we need so many factors to mutate, to reproduce,
yes,
am I
yes.
right? But it's not the same for organism. They just need
No.
a good environment, like the temperature
Oh,
and all, and they can just mutate as they like.
yes, and
And
evolve.
they can also mutate genetically. It's just by the change of their protein, by change of their RNA.
So how vaccine can help to prevent the COVID? How the vaccine works generally?
Okay, how vaccine works generally is, okay, the moment we get vaccinated, so
Yes.
automatically our body will produce this antibody
Oh, okay.
against that organism. It's not
Okay.
only this is a
Dr. Mirasha, are you still there?
okay.
I think the signal have got some issue because raining. Everywhere is raining now. Maybe the signal is not affected. It's been affected.
Okay.
Is it better, Dr. Mirasha?
Hi. Is
I
it
can
okay
hear
now?
you. I can hear you.
Okay, I
Yes,
can
yes,
hear
yes.
you
Okay.
too.
Yeah. So let's continue.
Hello.
Yes. Can you hear me? I can hear you, but I can see your video is buffering. Is it better now?
Okay. I can hear you.
Yes.
You can hear
Yes.
me?
Yes,
Okay.
I can hear you.
Okay,
Let's
we were talking
continue.
about the principle of vaccine. So
Yes.
the moment we get vaccinated, our body will produce antibodies. So these antibodies will like a standby soldier in our body. So the moment we get
Okay.
infected, so automatically the antibody will fight against the infection. So it's just as simple as that.
Oh,
This
that's why
is
some
the
people after
general rule, or this is the general rule for vaccine, whatever vaccine is
um,
it.
that's why
Yeah.
after some people that get vaccine they will have some fever or some uncomfortable
Mm-hmm.
effect, right? Is a
Okay.
normal thing like
Yes, it's a normal thing. Okay, when talk about these side effects of vaccine, actually, example that I will say is our normal kids vaccination. Even our
yes,
babies, when we bring them for vaccine, okay, from
yes,
birth until 2 years old, we will be always be cautioned about fever, about swelling at
yes,
the site of injection. Okay,
yes,
so and once our baby got, it's very normal, right, for babies to get fever after being
yes,
vaccinated, for
yes,
the site to be swollen,
yes,
especially the BCG scar can very easily get swollen and all. So these are
yes.
the the general side effects of vaccine. So when
Oh,
babies and all, they are getting this vaccine, so it's almost the same for our COVID-19 vaccine.
now also we have
Getting
the same.
fever,
Oh,
yeah, getting fever, swelling at the site of injection, and then your body feels a bit of tired, sleepy. This is actually, this reaction actually tells you that your body is actually reacting.
oh,
Fever is actually, everyone is thinking that fever is something bad. Yeah, actually but actually fever, it is telling us that our body is actually working. Our body is actually fighting against the infection. So that's why you're getting
oh.
fever.
So it's
Yes,
normal.
yes.
No need to worry too much.
Yes, no need to worry too much. It's
Yes,
a normal
normal process.
reaction. Yes, yes. I
So
feel that yes.
what you feel? You feel
No,
that?
I feel that if you don't have any reaction, then I think something is
Oh,
wrong.
should be worried about it.
Yeah, because your body is like not reacting. Like
No.
you are introducing something into the body, and your body just stays
No.
like, okay, I'm just like
No,
this.
only let
Whatever
them
wants
in
to
only.
enter. Just come. I'm like this.
Yeah.
Okay, so if you have
Yeah.
some kind of reaction, means like your body is working.
Oh,
Yeah,
yeah. It's very good example of this.
yeah.
So we have some
So
question from Winnie
okay,
Gunn.
someone allergic
Can
to.
some allergic
Mm-hmm.
to Boston or even
Okay,
normal?
when we talk about allergic reaction, okay, these have to be very careful. Those that having allergic reaction, allergic history,
Mhm.
generally they have to be careful to whatever vaccine they are taking, not only limited to COVID-19 vaccine.
Mm.
Not only
Okay.
vaccine, but in terms of any medication.
Okay.
This is because someone that is having allergic reaction, allergic history, no matter to what medication, even having allergic to seafood, we quite commonly we see people
Yes.
having
Yes.
allergic to seafood and
Yes.
all. So this group of people, yes, they have to be careful. So what I mean they have to be careful is that once they and normally before we register ourselves for the vaccine, there will be some questionnaire, and one of the questionnaire is they will ask you whether you have any allergic reactions or not, any
Okay.
allergic history. So the moment you say yes, and the day that you are going to take your vaccine, you will be monitored differently compared to the normal group. So what
Oh.
I mean is that the moment after you take the vaccine, they will really monitor you closely for 10 to 15 minutes. And the
Okay.
moment, because allergic reaction is a kind of acute event means it will happen fast. It's
Very
not
very
that,
immediate lah.
yeah,
Very fast.
immediate. It's not that it will take some 2 3 days, then you will have that allergic reaction. No. So the moment
Okay.
you develop the reaction, so there is a medication for you, and definitely they will give you
Oh.
immediately. Yes.
Oh, good to hear
And
that.
yeah, so again I'm saying that those having allergic history, they are a special group that need to be
Mm.
cautioned for whatever medication or vaccine they are taking, not
Oh, yes.
only limited to COVID-19. There's no such thing
Oh.
as COVID-19 vaccine gives more harm for a allergic person. No, I would say generally
Oh.
you have to be careful for everything.
So as long as they have to declare themselves, so that and
Yes,
then
you
the
have to tell
hospital
the
will take more
healthcare
notice.
workers. Yes, you have to tell the
Yes.
doctor
Yes.
that,
Yes.
and I'm very sure the questionnaire that we have to fill up, there's always a question, not only online, but even the day that we are going to take the vaccine, you have to answer few question line, hard copy also. So in that
Oh. Okay.
questionnaire, they will ask you about history of allergy.
Okay. So
Mm.
for the people that have diabetes, high blood
Okay.
pressure, all this, can they go for vaccine?
Definitely, they are the group of people that we are welcome the most because this
Oh,
group of
okay.
people, their immune system is very low.
Oh, okay.
So they need this antibody, they need the soldier in their body to fight against this COVID-19.
Oh.
When we look through the number of cases of deaths, I think our KKM is almost daily releasing all the numbers of
Yeah.
the people, the numbers of deaths.
Yes.
So if you look through the list, most of them are those having diabetic, hypertension, kidney
Oh,
disease. These are
the
group of people,
chronic illness.
chronic illness. So this is the group of people that is very easily get
Oh,
infected with COVID. Not only get infected with COVID, but it's very difficult for them
to
to get
recover.
to recover. It's like
Oh,
definitely there will be progress into the worse. So
oh,
that's why we actually
recommend, encourage
strongly
people to go.
recommend, and even that is the main reason we open our vaccine for more than 60 years old to register first for our senior
Yes.
citizen. This is one of the reason.
Oh, I understand.
And
Yes.
there is no such thing as those having this hypertension or diabetic that will develop a serious side effect after taking vaccine. There is no such thing. They will
Oh,
develop a serious side effect if they are getting infected with COVID and not being vaccinated. Yes.
oh, I
Yeah.
see. It's very good. Huh? So another question from NG Chu. Is the
Okay.
kid that positive COVID? let's say 3 to 5 years old, the kid will be admitted without the parent, or parent that negative COVID can stay with the kids in hospital. I
Okay.
think can, yeah?
Yes,
You cannot
normally
keep the
what
kids
we
to
do,
themselves.
yes, normally what we will do, the moment we receive a kit
Yes.
suspected, not only because we will never know before we take the swab, am I right?
Oh,
So the
suspect.
moment we receive a baby, a kid with
Suspect.
COVID-19 suspect, we will allow the mother and the kid to be isolated in the room. The mother definitely.
So
But
both of them need to do the swab test also lah.
normally the mother know, the kid yes. But if let's say the kid turned to be positive, then the
Okay.
whole family will be screened.
Oh,
But we allow the mother to be with the kid. So if
okay.
let's say at the COVID team that I said that in my hospital, like the COVID ward,
Mm-hmm.
so we allow the mother and the baby, the kid, to be isolated in the room. But
So,
it's no for father, no visiting time, no any
oh,
visitors allowed. Yeah, that's a difficult part. No any visitors allowed until the swab test return negative.
but it's good that we have technology to help us so that we can video call at least to release. I
Yes,
mean, at least their
yes, yes.
parents can see the baby or their
Yeah,
father
even
can see
if
the baby.
even
Yeah.
if they, it's so strict that even if they want to deliver any things,
Food
any
also can.
yeah, we will
Oh,
help them. The nurse will help them to bring it into the room. Like we
oh.
will wear the full PPE, then we will help them to bring the
They have
food
to
or the
sanitize the thing.
yes,
Say
yes,
I bring
yes.
the
But
clothes or.
food is very rare. We don't allow for
Mm.
food, but let's say for any things, like clothes and diapers and also yes. But we will
Oh,
never allow even the father to
yes. I think
visit.
it's you have to practice this. Are no choice.
Yes, yes.
For
It's
both
not it's not
everybody's
only
safety.
for suspected case. Actually, now in hospitals, the visiting time is being modified. So we don't really encourage visitors in the hospital.
Oh, I see. Yeah,
Yes, yes.
better. Yeah, better.
Yeah.
Because more people going in, the chances to cause infect is more higher.
Yes, yes.
So another question from Felicia. Today, many questions for you.
How
How
long
long
does it
does the breastfeeding mother need to wait before she
she
can
can
breastfeed again or can breastfeed straight away?
she can breastfeed straight away?
Oh, even
Mm.
I think this question is after you take the vaccine or what?
I
Take
think
the
it's
vaccine.
after we take the vaccine, so we
Oh,
can
okay.
breastfeed straight away. There is no any waiting time or
So
what.
if mother that have COVID cannot breastfeeding, right?
Yes, because why? Because we will isolate the mother from the baby.
Oh, that's why no choice to nowhere to
Yeah.
be feeding anymore.
Yes, yes,
Okay,
yes.
okay. So, for you have take the vaccine, right? You have took the
Mhm.
vaccine. So how you feel after you take the vaccine?
How I feel means that
Yeah, I mean during that time you have
mm-hmm,
to be because you are the first batch of people to take the vaccine.
mm-hmm.
So how you feel about it? You feel excited, nervous, anxious, or how? Oh yeah, happy I will be the first batch.
To
Yeah,
tell you the truth, I was like my feeling was like feeling
normal.
like nothing normal. And I
Because you
feel like I should get vaccinated because I'm in a very because of
high
my
risk.
job, so high risk to get infected very
Oh,
easily because I will never know anyone that I meet. I won't know their status, whether they are
yeah,
positive
yeah,
or
you're right.
negative.
You're right. Now
Okay.
cannot see.
So the first, but the one thing that I was a bit worried that I was breastfeeding at the time, but
Oh,
after receiving comments from my consultant, they do share with us studies and articles, and they
oh,
do explain to us how is the mechanism of this vaccine works and
vaccine
all.
works.
So then we were quite convinced, and we took the vaccine, and it's true based on what they said, it doesn't give any side effect to
Oh,
us.
yeah, very good
Mm.
about that.
But there's this psychology, it's like automatically this psychology, like
Yes,
the
yes,
moment
yes.
I get vaccinated, I feel like, oh, okay, I'm safe now. Even though there is a risk that you can get infected, but like a normal being, like you feel
Yes,
that
yes.
you're getting something extra.
Mm.
So
Yeah,
like, oh,
Superman
okay,
already. Not
yeah,
Superman.
like now, like, oh, okay, I'm ready to face anything. So that kind of
Yes.
feeling.
Leong have more confidence to face all the patient.
Yes,
That is
yes,
good
more
to see that.
more confidence, and you yourself feel like a super,
Yes.
like, yeah.
Wonder Woman.
Yes, yes, something like that. Because
So,
now I always say to myself, it's like now everyone is COVID-19 until and unless they are proven. Because now it's going like that, Like everyone you meet, you will never know. Then, and those like even without symptoms who look very healthy also can get
yes.
positive. Yes,
Yes.
yes.
So, after you take the vaccine, got any side effect from your side, from you?
Local side effect means we will say
Do
local or
you feel
general.
no after
In
you
terms
took
of
after you
local effect, I had swelling. Definitely, I had swelling over the side that I couldn't lift up my arm for like one day. But I know that this is the common side effect, so I just go with it, and it resolves by spontaneously. I didn't
okay.
apply any medication, nothing.
So you
And
don't have
then
fever,
yeah, I
don't have
didn't have fever. I didn't have
just swelling.
fever, but I
Very good.
have a localized a localized swelling over the side of the injection.
Yes, very good.
But other than that, I didn't have any other symptoms.
Okay. So we
Mm.
wait any question for Dr. Mirasha because I saw the time is quite some time already. We talk about we have this kind of chit chat. So you don't have, then I will say thank you to Dr. Anisha because I know you need to feed your baby
Yeah.
soon. Okay.
Okay.
So
Anyway, thank you so much. Thank you, Jasper. I think I got to know about this show from you, and I feel that it's a very good, beneficial show. It actually gives a very. I hope that I gave a clearer message to
yes,
everyone
yes,
regarding
very
this
clear.
vaccine and the COVID. And the vice versa, and also I hope I have cleared the doubts. So,
Yes,
and
definitely.
thank you so much, Jasper. So to
Yes.
to include me in this talk show.
Yes,
Yeah.
thank a lot for Dr. Mirasha. I hope I see you again.
Okay. Sure.
So thank
Sure.
you again. So if next time we got chances, we invite you to our talk
Sure.
again.
Sure. Sure.
Okay,
I'm
thank you.
very overwhelmed to join the show.
Yes, it's very great to have you. We are neighbor.
Never. Yeah.
Yeah. Okay. Thanks a lot,
Okay.
Dr. Mirasha. See you
Okay.
around.
Bye. Good night.
Okay,
Bye.
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 Yes, I hope. Thanks again for Dr. Mirasha to share all the informative info to us. So it's really clear my doubt because before that I had a lot of doubt about vaccine all this. So after all this, talk with Dr. Mirasha, so it really clear my thoughts, clear my doubts. So um, this is the sharing from Frontliner. So coming up, we will have few friends from different industry and different age to share with us what they're feeling before and after they took the vaccine. So first of all, I would like to invite our special guest, Mr. Chew Hock Ping. He's my teacher.
Hi.
Hi, Mr. Chew. Good
Hi,
evening.
Jasper.
Yes.
Okay.
So
Yes.
I will invite another guest, S.T.Chua, Mr. S.T.Chua. Yes. And
Hi, Jasper.
King Leong from our Kingdom Group.
Hello,
Hi,
everyone.
everybody. Hello. So I hope you all benefit from what the sharing from Dr. Mirasha also. You are in the show, right? Yeah.
Yes,
Definitely.
very
Definitely.
informative.
Yes. So you are the first or maybe a second or third batch people that do the vaccine, is it? I
I'm
believe
the
lah.
second batch.
Oh, Dr. Chu, Dr. Chu, our second batch. Mr. Chu, our second batch. So,
Yes.
Mr. Chu, I want to ask you what. As I know, you are almost age 80 already, right?
Yes. Next week. Next month. Next
Next
month I'll be
next
80.
month, you're age 80. Oh, so good.
Wow,
So,
congrats.
what are the reasons that make you want to take the vaccine?
Yeah, because I belong to the high risk group. The senior citizen, and
Yes.
I very value my life. So I want to protect myself and prevent the transmission of this COVID-19.
COVID.
So
Oh,
I was very keen to take vaccinated.
oh,
So
very
I
good. So before that,
yeah,
because a lot of people they have a lot of doubt especially senior citizen, is it safe? Is it all this? So you are very keen that very sure I want to go for it.
Yeah,
Is it?
because the people who take the vaccine all over the world, and you've seen the results, and people get well,
Very
So it give me confidence, and really look forward for this to happen.
very good, very good. How about Leong? How about you? What the reason that make you want to take the vaccine so that you can go out
No,
everywhere?
no, actually, it's because of the risk and uncertainty of COVID-19.
Okay,
So at least this vaccine can give us some assurance, like in terms of, once getting it, we won't, in a way, won't
easily.
get a serious side effect or something like that. So
Oh,
yeah, that's one of the
very good,
reasons why.
very good, very good. How about you, Mr. Chua?
I actually, there are two reasons that I want to take this vaccine.
Okay.
Actually, I took this vaccine because I think a few weeks ago the government opened it for the AstraZeneca vaccine. See,
Yes,
so
yes,
they opened up on Sunday. I think it's a Sunday.
yes.
So I straight away register for it lah. The main reason is because of the government actually did quite well of advertising this Lindong diri, Lindong semua. So
Oh,
this
the
one,
slogan make you want to do the vaccine.
yeah, this one very effective, effective.
Oh, very
And
good, very good.
of course, another reason is we have to protect ourselves lah. Because what happened is you can see from all the statistic
Mhm.
the vaccine the case is like every day been raising up and up,
Yes,
and actually all the medical facilities in the whole Malaysia is already up to their neck,
limit lah,
up
overwhelmed.
to their limit already. So please protect yourself and don't make more burden to all the medical staff.
Yeah, all
See?
the frontliner lah. Yeah.
Yeah, frontliner, because they are working 24 hours, 7 days. It's like no rest
Yes.
for them. They have to protect themselves also. So
Yes.
I think this is one of the very, very important reasons that I want to take up this vaccine.
So when you take the vaccine, Mr. Chua,
I took it on the 16th May.
16 May. Where you
Yeah.
take it?
The
If I know
BTC.
have different kind of places to take the vaccine, right?
The
You take
BTC.
PWTC. Oh,
Yeah,
okay.
PWTC. Yes, correct.
Okay. How about you, Mr. Chua? Mr. Chu, where you take the vaccine and
I
when?
took my vaccine at the stadium, Wong on the
Okay.
17th of May.
Oh, well,
Yeah, so
May.
17th of May. Yes, I was very excited to
Excited date for you.
portray.
How about you, Engyang? Where you take the vaccine and when?
I did mine in PWTC as well.
Oh, PWTC as well.
So yeah,
I
mine
want to
was on
know
the 20th.
20th. Is it you all can choose the place or government allocate you to different places? Is it
It was,
Mr. Chu, you choose to go to Didi Wangsa?
it was allocated to me.
Allocated.
Allocated to me. So because we stay in KL, so we can go to any part of KL to get vaccinated.
Okay,
but
because
the place-
you are very near with Mr. Chua, I thought you all will be go to the same place.
no.
No, because my one is
It depends on when you register,
Register.
and after that they will distribute the people to go to different places.
Oh.
So
Mr. Chua
anyway,
is volunteer, that's why he's in different place, is it?
Yeah, I volunteer it, and actually you
Okay.
you have to select a venue lah, a center lah. So when I choose the time, I select.
You can select
BTC
one.
lah. During the time they open for the
Oh.
AstraZeneca, you can select. You can select to UM lah, PWTC lah. There are few venue and center lah.
Oh, okay. So any preparation you do, Mr. Chua, before you take the vaccine?
Not
preparation
really
you do?
lah, because
Exercise.
because my vaccine actually is at 6 p.m. All right. So I had
6
my
p.m.
lunch, everything. Then of course, I brought all the necessary thing lah. I brought my own pen lah. You have to
You brought your own
contact
pen.
people lah. Yeah, yeah.
Yeah. It's cute also,
Because you need to fill out some forms, you see.
Oh, so don't use
So
the
the
pen that
advice-
everybody touched before.
Yes. Yes.
Very smart. Yeah, I don't think about that. Oh, very good.
So
How about you? How about Ding Leong? Any preparation you do before you go for vaccine?
The usual stuff, make sure your phone is there, your IC, pen, and then getting enough sleep, eating before you go there, drink lots of water, and then preparing the Panadol at home just in case I
You
get
need
the
it.
side effect lah.
Oh, very good. How about you, Mr. Chiu? Any preparation? What are the preparation you do before you go for vaccine?
Yeah, I need to sleep well. My vaccination time was 2 p.m. So
2
I
p.m.
took
Okay.
time to get myself ready. So slept well and then drank plenty of warm water. And I also prepared some fruit juice like celery, bitter gourd, apple, green apple. I make all these juice and I drank plenty of time and have a good lunch at 12 before I went.
Yeah, that's the important
So,
part.
yeah, important. I make sure you're not hungry because
Yes.
for me, so many people want me. Hey,
Yeah, my
better
queue
eat
very
more.
long queue, right?
There's a long queue, gonna wait for a long time, and even ask me to bring some bread or something along in case I get
Oh,
hungry.
very good, very good.
But
I think I should do that
no
also.
chance. I have no chance to get hungry because I was more anxious to get vaccinated than to
just-
think about your hunger.
More worried about the hunger than the side effect, is it?
No, I'm not worried about my hunger. I'm worried about the queue. I want to get over it
the queue.
and get it done over faster. So
Yeah.
there'll be a great relief. But on the day, there was a big jam because it was raining and the road leading to this stadium, was very narrow, so a long jam and with the rain and the queue was a bit
Very long.
too long, and then we got to wait outside the hall, and a long queue, and it took 1 hour before we reached the entrance of the hall.
Oh,
But once
okay.
we were in the hall, we were
Yes.
relieved because people were very friendly, asked you to fill out the forms, and then you're brought to the doctors who ask you a lot of questions, and I also show my medication, and the doctor advised me which one to go. So I will accept whatever vaccine given to me as long as I get it done.
Yeah, it's important also you take your medicine that you're taking now to show to the doctor, is it?
It's because the doctor needs to know my medical history. So
Yes.
I have this, my blood sugar high, and then high blood pressure and cholesterol. I show all this medicine, and the doctor put me to the Pfizer vaccine.
Oh, okay, very good, very good. How about Ding Leong and Chua? You have any allergic before you took the vaccine? I mean, you got any allergic or medical history to tell the doctor before that?
Okay, actually, the doctor will ask you lah. Basically, the doctor, they are more worried about the allergy that you have related to your respiratory system lah.
Respiratory system.
Your lung, your throat lah. Other than that, if you have skin allergy, that one they say is not a big deal lah. So actually, I used to have a skin allergy a lot lah. So I did tell the doctor, but the doctor say, that one no worry.
No worry. Oh, very good.
As far as you don't have any asthma issue and all that thing, they say is good enough. Go ahead and take. So I take.
Oh, very good. How about Eng Leong? You got any allergic or anything? I mean, during you before you took the vaccine, doctor got asked any question, any issue that you're facing?
I think this is a standard SOP for all the doctors to check whether anyone who is coming over to take the vaccine, whether they are allergic to any medicines or like what Mr. Chua said,
Yes, very good.
respiratory system and stuff like that. But fortunately for me, I've got no issues with allergies.
Anything lah.
So yeah, mine was very straightforward. Went
Yes,
there,
very
they
good.
asked me the question, nope, okay, good to go. And then they just passed me off.
So Eng Leong, so in PWDC, right, is it same as what Mr. Chu told us? Like a very long queue, all this, is it this same?
Yeah, yes. The queue in PWTC, I think, is the longest in a way
Wow,
because it's one of the center that's catering to 8,000 plus
wow,
vaccination a day. So the queue was a lot, but it was pretty smooth lah.
Oh, pretty smooth. Oh, good to hear that. So Chua, during the time you go for the vaccine, also very smooth, right? Everything running smooth?
Very smooth. Actually, it was a Sunday some more. Then actually I look at the watch after I park my car there, walk into all the vaccination center.
Okay.
From the time I walk out, exactly 1 hour, got him everything.
Oh,
So it's very, very smooth, very organized. People explain everything very nicely. You don't even have time to think, sit down and even look at your phone or do all these
very
things.
smooth. Then
Yeah,
you
you
being
just-
quite fast.
Yeah, quite fast.
Oh.
You walk, sit, then done.
Done already. Very good,
Yeah.
very good.
You
So, Mr. Chua, how you feel?
you feel like an animal like that lah.
Oh, you mean?
No, like
You
feel like you're
like
going back, you feel like you're going back to school. You listen to instruction. Hey, okay, you queue here, you sit down. Line by
Like
line,
the-
is it
and
okay?
then there's a lot of barriers.
Like the
Yeah.
student
A
will
lot
take
of
the food.
barriers.
Oh, very good, very good.
They ask you go or this line first, that line second, third line, all go.
I mean, very systematic, I can say that.
Yeah, quite very systematic.
Very good, very good. So, how did you feel when you took the vaccine, Mr. Chua?
Actually,
How
I
you feel?
feel
You feel
nothing.
anxious, nervous?
I feel a little bit nervous, but after they put the injection, I say, done already. I actually I didn't feel a
Oh, very good.
thing.
I feel nothing. How about you, Eng Leong?
Well,
Do
relief
you
and
feel-
happy.
You feel happy before you take the vaccine?
Before in a way because of the exposure, the negative exposure that you're hearing from social media and stuff like that. So
Yes.
definitely you feel anxious. But then when I decided to go for the vaccine, it's just the anticipation of getting vaccinated. Then once I got vaccinated, I was relieved and happy.
Oh, very good. How about you, Mr. Chiu? How you feel before you took the vaccine?
I was very nervous because I waited. I registered as early as February, and then only in late
May.
in May I was notified. So
Okay.
anyway, the day I was very nervous, but I have to relax, especially when the needle was going to put on my arm. Is it?
Yes,
So,
yes.
but the thing was so fast it happened. You didn't realize that there was any injection at all. So fast, and like the moment, so, done. So I was very
Don't feel
happy.
any pain or any?
Yeah, I had no pain or anything at all except when I reached home, my shoulder, my left arm where the injection was done, a bit painful. I couldn't lift my arm, but that's for a few hours. But after that, it came to normal. So
So you don't have any other side effect except for the little bit pain on your arm.
That's why I couldn't lift my arm for a while, just a few hours. But after that, then I was told not to lift any heavy things on my left hand. So I relaxed
So you
and
don't have fever. Don't have
no
fever.
fever at all.
Oh, very good.
No fever, and some of my friends, after the vaccination, they went home and they felt tired and they slept the whole night. But I was all right. I only a bit tired, but I didn't feel sleepy. So,
Oh,
but
very
that night I had a very good sleep
Oh,
because
very good to hear
glad
that.
because it was over, and I'm really looking forward for my second dose.
Oh, yeah, very good, very good. How about you, Mr. Chua? After you took the vaccine, do you got any side effect or any uncomfortable?
After the vaccine, actually during midnight, I feel a little bit. I feel chilly lah, falang ah, in
Oh,
Cantonese.
yeah, okay.
Yeah.
Okay, if
So
you cold lah.
yeah, I feel cold, but I don't care. I just covered it with my blanket from top to toe. Then just sleep lah. Second day wake up, okay already. But then another side effect of mine is actually the my both legs
Okay.
feel a little bit sore like that lah.
Maybe you run
Uh,
too many. You
no, no,
jogging
no,
too
no,
much.
no, no. I didn't jog for some time already, so
Okay.
it's not related to that. But the feeling is like after you run maybe 10 kilometer marathon lah.
Oh, do you feel
So
sore like that? Oh.
yeah,
Maybe
but
you run in your sleep,
sleepwalker that
run
one.
in your dream, run in your dream.
So
Okay.
basically, I took the vaccine on Sunday.
Mhm.
Then Tuesday, everything back to normal.
Oh, very good, very good.
But Monday, definitely feeling a little bit tired, a little bit like not comfortable lah. But
Maybe.
Tuesday, after I wake up, everything back to normal already. Nothing
Oh,
really.
okay.
Yeah.
How about Eng
That's
Leong?
good.
How about you? How about Eng Leong?
My
Any
side,
effect?
my side effect was body ache, slight headache.
Headache? Oh,
Um,
okay.
yeah. I did have
Watch too many
a
movies,
mild
is it?
headache. No. You got after the vaccine, you won't feel like watching movie.
You just want to
You
go.
feel tired.
Oh, feel tired.
You feel tired. Yeah.
Oh,
So
okay.
took 2 Panadols and then just slept it off lah.
How many days it take you to recover, like back to normal?
It took me 2 days.
Or 2 days?
Two
Oh,
days.
okay.
Yes.
Trial also
But
take
the
2 days.
my injection arm was painful lah. So that one went away quite. It took a longer time to recover.
Oh,
Oh yeah, same. My one arm also maybe about 3-4 days
Yeah.
Little bit pain, but it's not those pain that
Yeah,
you
it's not
cannot
painful
tahan.
until you cannot move.
oh. But you
Yeah,
can
because
lift up because Mr. Chu
Can.
have side effect that cannot lift up for a few
our
hours.
one can, no problem.
Oh,
No problem.
well, then I can
No
see
problem.
Mr. Chu is the people that have least side effect among y'all. Very good.
Yeah.
I'm worried now because the doctor said if you don't have anything, then whether it's effective or not.
Maybe Mr. Chu had drink the fruit juice to boost the immune system. Maybe.
Yeah, maybe because of that.
Yeah. All the bitter
Because
gourd is
they
very
asked me
good.
to drink coconut water, but instead of coconut water, I drank the bitter gourd. A lot of
Yeah.
people
Wow.
don't like to because it's very bitter.
Very
Is this?
bitter.
I drank the bitter gourd and some green apple juice. So
Very good.
nice.
Oh yeah. I heard Mr. Chu mention about coconut water because I brought my mom for vaccine also on
Okay.
Tuesday. So actually, the doctor advised not to drink coconut water after injection.
Or
So this
after
After injection. So
Oh.
please,
okay lah.
before he never mentioned so it's after injection don't take. So
Okay.
I let you all know lah. The
But
doctor will.
any reason that doctor say cannot take? I mean, not advised to take.
No, he just mentioned don't take. So we also after done, better leave the hospital fast.
Yes. Don't ask too many questions. Okay.
because I think it's after the vaccination, you should drink a lot of warm water. It's
Oh,
very, 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 very important. Warm water.
is it
So
Kenyan say Mr. Chu is strong? Mr. Chu is strong.
Definitely.
So anyway, the next day after the vaccination, I think the next day I went for the day after I went for the morning walk.
Wow, next day go for morning walk also. Wow, power. The next day go for
Because
morning walk.
I felt nothing. Nothing.
very
I
good.
Next day I was
walk
sleeping on
slowly,
the bed.
but I did not run. I walk only. I did not walk fast. I just walk slowly only.
So
No, the
next
next
day, Leong is
the day
sleeping.
after next, the day after, because the next day it was raining. Tuesday, I had a vaccination on Monday. Then I
Okay.
wanted to go on Tuesday, but it was raining, so I went on Wednesday morning. So just walked, walk
Okay,
slowly, breathe some fresh
very
air.
good.
You know. So,
Yes, very good, very good. So, Mr. Chu, how you feel? How do you feel now after you took the first dose of your vaccine? How do you feel now?
I feel more confident,
Okay.
especially after hearing the doctors mentioning when you have your first dose, your
Superman.
resistance is better. And so I feel very. Actually, I'm very happy that Jasper invited me to come for this session, and I
Yes.
learned really a lot from this Dr. Mirasha, and she gave me a lot of confidence of of uh, of what happened when I've taken my
Oh,
vaccine.
yeah,
So now
good
I
to
feel
hear.
more happy because otherwise I was very worried, because the cases you reported
Yes,
every
yes.
day, even
Increase
7,000
every
something.
day.
So I'm worried, but now I feel more confident that my resistance is better.
Yes,
Thank.
very good. When is your second dose, Mr. Chu?
My second dose will be on the 7th of June. On the 7th
Oh,
of
wow,
June
next month,
is
very fast, huh?
yes, 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 yes.
Oh,
So I'm
same
looking
place.
forward for it.
Oh,
But
looking forward to it. Very good.
I hope the queue will not be that long, because the jam is very. You have
Maybe
to
maybe
you
the
have
day is
patience.
raining, right? Like you mentioned, the day
The
is
day
raining.
was raining,
Maybe.
yeah, and the
Yeah,
car park
hopefully.
very difficult to get car park.
Oh, okay.
Of course, I didn't drive. I was driven. I was
Oh,
driven
well, very
there
good.
by my friend. So
Okay,
it's
very
all
good.
right.
How about Mr. Chua? How you feel now after you took the first dose of vaccine? Feel like
Uh,
Superman?
I hope I can become Superman, but I'm not. But of
Because
course,
you're Batman. You're Batman.
but obviously, you feel more confident, even though it's still very risky going out because you might still get the I mean the virus, right?
Yes.
But then of course, with the vaccine itself, I think you're more protected lah.
Yeah, definitely. I believe that
Yeah.
also.
Even if you got it, also maybe you won't be so harmful to your body, especially your lung, because this COVID is actually a
It
lung
will attack
related
lah, attack
disease.
the
You see.
respiration system.
Yeah, correct. So I feel good. I feel good. So I encourage everyone to go and do vaccine, no matter what kind of vaccine. As the doctor said, please go and do because protect yourself is to protect your
Lindung
family.
Lee, Lindung, what? Just not the slogan.
Lindong diri, lindong semua.
Okay, very good. How about you, Eng Leong? After you take the vaccine, how you feel like?
Well, to me, I feel normal lah. Nothing
Okay.
special. You don't feel like Superman lah, definitely. So it's just the assurance or the self
Okay.
assurance that you won't
Okay.
get into serious
Serious
situation if you
situation.
get
Yes,
COVID lah.
correct.
Yeah.
So
So
after you
nothing.
take vaccine, you all won't go around everywhere, right? You won't pergi
Still,
sana
No,
pergi sana, right?
no, still
Yeah.
don't go.
definitely not. Definitely not.
Oh, very
Still,
good.
still stay at home as
Oh,
far as possible.
yes, very good, very good. So I think this most all the question that I'm asking. So you see any, from the floor got any question for our guest, special guest today? So if not, then I think we will end the section. So lastly, I would like to thank Mr. Chiu, Mr. Chua, and Eng Leong to participate in our Coffee Talk and spend your time with us. So I hope that mm, you all have to be safe also. So really appreciate your time and your effort on that. So thank you, Mr. Chiu, Mr. Chua, and Eng Leong. Thanks a lot.
Thanks,
Thank you,
Jasper.
Jasper.
Thank you, thank you,
Thank you very
thank you
much.
for the invitation.
Yes.
Yeah.
Okay. Good night.
Good night,
Right.
good night,
Good night.
everyone. Yeah, stay safe.
Good night.
So that's all from our Kingdom Coffee Talk tonight. I hope we can bring some value and info to people that in front of the screen. So if you have any question, you can direct inform. Us in our group, our Facebook Live. So I would like to share about information also, some information. So as we are from AIA Insurance Company, so we are representing AIA. So please make sure your policy that you have is covered for COVID in private hospital. So because AIA do full cover for COVID that need to be admitted in private hospital even, and also all the side effects that come up that for the vaccine, COVID vaccine. So if you wish to know more about this kind of information, you can put some mails, send me email to us, or you can ask the friend that invite you to for this coffee talk. Okay, thank you and good night, everybody. See you.
So we're changing too, constantly learning and evolving to be more useful to you. So what if your medical plan could do more for you? What if it could encourage you to live healthy? Introducing A Plus Health, the medical plan that rewards you for living healthy, and the first of its kind to do so. With our Health Wallet feature, money will be credited into your Health Wallet when you don't make a claim for the year. And you can use it to support your health journey with benefits that are not typically covered by medical plans today, such as prevention, special care benefit, recovery and support benefit, Protect Boost. AIA Vitality members can also enjoy additional benefits, depending on your AIA Vitality status. Because if you're staying healthy, why shouldn't you be rewarded? That's what we believe. But we also believe in providing the best coverage when you need it. A Plus Health offers an annual limit of up to 2 million ringgit and no lifetime limit for inpatient and outpatient hospital expenses, such as outpatient kidney dialysis and cancer treatment. Apart from that, we now cover maternity complications, optical support, and more. For added value, you can choose the 300 ringgit deductible option to enjoy lower premiums. Because however much we change, we always want to give you the best. A Plus Health, the first medical plan that rewards you for living healthy. Brought to you by AIA, enabling healthier, longer, better lives.